So still trying to look at different infections and how they could affect the mother, how they could affect the baby in pregnancy. The next one we should be looking at is rubella infections. Okay, so you can see rubella rashes. So for this one, it's also known as what? German measles. It's also known as German measles. Okay, so this one is also known as German measles. It's a viral infection. Alright, so it's usually mild in children and adults. But if it occurs in pregnancy is a special condition. Do you understand? The baby in pregnancy, the immune system is not really fit yet. The mother in pregnancy, her immune system is weak. This is because there are several changes in her body. Do you understand? So you can now give the virus a ground to basically destroy a lot of things. So why it is dangerous? Congenital Rubella Syndrome. So if a pregnancy person contracts rubella, especially early on in pregnancy, that's what the first 3 months of pregnancy, the virus can cross the placenta and affect the baby. It can make your baby to be deaf. It can make your baby to what? Be blind because of cataracts. It can cause what? A lot of heart issues in the baby. It can cause intellectual disabilities in the baby. You give birth to the baby and the baby has tough time trying to even talk. That's when it's time to start talking and all of that. It can cause liver issues, can cause spleen issues. It can cause low birth weight. It can cause the baby to have this type of rashes during childbirth. Okay, then miscarriage or stillbirth is also a risk if infection occurs early in pregnancy. So diagnosis is blood test because you want to check if there's an immune system mounted against rubella. Do you understand? Of course, if you see that there's an immune system mounted against rubella, this confirms that rubella is there. All right. So if you see hemoglobin M, it shows that there's a recent infection. The infection is still ongoing. But if you see hemoglobin G, it shows that there was an infection but it is gone. So the body is just trying to mount a preventive stuff. So also ultrasound to check if there's any abnormalities with the baby coming up. Then amniocentesis, this is because you want to confirm fetal infection. Okay, so actions: vaccination, okay, preconception screening, avoid exposure, then postpartum vaccination. Right, even after childbirth you vaccinate the person. Okay, so this is just how the rubella, if it occurs in pregnancy, it can affect the baby mainly.